This is a case of an 80-year-old woman who presented with abdominal pain, fecal vomiting, abdominal distension, and CT scan was done to rule out bowel obstruction. Let's have a look. I will scroll the images and you will make your impression. As you can see, there is significant dilatation of the small bowel. Here are the dilated small bowel loops. There are some air fluid levels. The large bowel is almost collapsed. There is no dilatation in the large bowel. There is some fecal loading here in the rectosigmoid colon. So the next point is to find the cause of the obstruction. But another interesting point is that there is pneumobilia here. And the anatomical region between the gallbladder and the duodenum is abnormal. By the way, as an incidental finding, there is this lesion in the right breast. This is incidental finding. It shows irregular contour, so we have to report it. We have to mention it to the report for further evaluation. In many instances, the coronal views are really helpful in case of bowel obstruction, and at this point we can see this structure. I will zoom in to see it better. So this is a gallstone. If we track the dilated small bowel here, it goes on. So let's go back again to the gallstone. The small bowel dilatation stops exactly here. So there is a pre-stenotic dilatation from this point. The rest of the small bowel is collapsed. This is the distal ileum. And here is the ileocecal valve in this region. Let's go back to the right upper quadrant again, and let's have a look to the gallbladder. Here is the gallbladder, and here is the duodenum. Stomach, pyloric antrum, and duodenum. And at this point we can see first of all that there is gas intraluminally in the gallbladder. There is significant pneumobilia, and here is the region of the erosion between the gallbladder wall and the duodenum, and the fistulization between the two organs. So the gallbladder, the gallstone passed through this fistulization to the small bowel. So this is a case of a gallstone ileus, which is a rare form of small bowel obstruction caused by an impaction of a gallstone within the lumen of the small bowel. Usually large stones, larger than 2.5 centimeter in diameter, enter the bowel via cholecystoenteric fistula, as we saw previously. So a stone may travel from the gallbladder into the bowel and become lodged almost anywhere along the gastrointestinal tract. Here in this case, in this region, traditionally we call this condition Gallstone ileus. However, this is a misnomer because an ileus is by definition a non-mechanical bowel motility failure. But in this case we have a mechanical obstruction by this gallstone. Dear friends, thank you for watching this rare case, an interesting case. If you like my videos, you can consider to subscribe to my channel so you will be notified the next time I will upload the next video to my channel. Thank you again and see you the next time.